Hello and welcome to another episode of the Dermatilla Diaries. Today I have with me a very special guest who's already been featured in Allure and Women's Health. She's a doctor of medicine as well as a fellow of the American Academy of Dermatology as a board-certified dermatologist. It's Dr. Karhade. Thank you so much for joining me today, Dr. Karhade.
Thank you so much for having me. I'm so excited to be here and share some of my tips for skin.
Amazing. I've been so excited for this, and I know I'm not the only one. So I can't wait to ask you the questions that the community has put forward and hearing your thoughts and any tips. I think is going to be pretty awesome. So I wanted to firstly start because I think it would be great to understand a little bit more about your professional journey and what interested you in starting your career in dermatology.
Absolutely. And thank you again for the warm introduction. As she mentioned, my name is Dr. Karhade. I'm a board certified dermatologist in the San Francisco Bay Area. So I trained on the East Coast at Brown University, worked in New York City, and now work in San Francisco. So I've had some experience working in different parts of the United States. And one of the things that I love about dermatology, and actually the thing that got me into dermatology, is the psychosocial aspect of dermatology. So when I was in medical school, I helped with a research study on looking at the impact that stretch marks have on pregnant women. And to many people, it may seem like it's an appearance related thing. It's a relatively quote unquote superficial thing. But the fact is, these things matter to people. And so it was striking to me in our findings that having severe stretch marks actually made people view the pregnancy more negatively. That was very shocking to me. And it made me realize just how significantly skin can impact us. So while something like acne or brown spots or hair loss may not be the most physiologically complex disease process, or it may not be something that would lead to mortality or end of life, it absolutely is something that leads to decreased self-esteem, your confidence level, and it really impacts the way you even view yourself. And so that is my main reason I am a dermatologist. Every single day, it is rewarding to be able to help people with their skin and be able to help people have that feeling, even when you wake up in the morning and you look in the mirror and you think to yourself, I look good today, I feel good today, I'm ready to take on the world. And that's my job, to help people get there. And so that's really where my interest in dermatology stemmed from, using science to help people be their best selves and present their best selves.
That's amazing. And I can only imagine just how satisfying and rewarding that is to see people turn that corner and to, the results that they may want to achieve, but not so much just the physical, the kind of the self-esteem, as you say, the self-confidence, because ultimately we're wearing our skin all the time. And even though you see a lot of things online saying, like your appearance isn't everything, and you can also feel a bit bad about worrying about these things.
Exactly.
Like, there's a lot of shame and guilt in seeing these as unquote first world problems, but ultimately they can severely decrease self-esteem, self-confidence, and
absolutely.
And there's a lot of mental disorders that can jump on that, and it can become like a never-ending cycle in your mind of worrying about these things, especially with dermatillomania, obsessive skin picking disorder. And one of the questions that I received was as if, I don't know, in your personal experience or through, other dermatologists that you've worked with or trained with, have you come across compulsive skin picking disorders often? Have you found people come to you and talk about their disorder with you?
Absolutely. So I think the technical term dermatillomania, referring to the psychological aspect where the skin picking has come to a point where it severely impacts daily functioning in life, that is a clinical diagnosis. But I think that there are variants of that at pretty much every level. I actually think that almost everybody has some level of skin picking tendencies, because probably 90% of my patients admit to picking their skin, and in some shape or form, I admit to picking my own skin. I tell patients not to do it, but I do it myself, because I think that there is I've thought a lot about why this starts or why it happens. And I think it's because of a little bit of a control thing. trying to get rid of something that seems flawed or erroneous on our skin is one way of maintaining control over something on our bodies, whereas there's a lot of things happening on the inside that we may not feel we have control over. So skin picking is extremely common, and it does lead to a lot of subsequent skin issues, such as broken skin, scarring, hyperpigmentation. And so I see lots and lots of that every single day from anyone, from the mildest aspect where people just have kind of a habit of popping pimples when they come up, to much more severe, functionally impairing versions of it.
It's really refreshing to hear that, because in my own experience in the past, not with a dermatologist, but with medical or doctors of medicine, they haven't been as aware. And it's very refreshing to hear someone in your field who just completely kind of gets it from the medical standpoint. Because I think there's a lot of people, especially those who've some feedback I've received when gathering some questions for this call, asked, about the experience of going to a dermatologist with this, and the fear of being shamed. Or kind of brushed off. And so would you say that it's kind of more widely known now?
Absolutely.
Okay.
I think as mental health is becoming more and more understood and recognized and valued in the world, we're realizing that there's not always an easy solution to these things, right? Like a lot of people with skin picking, there's a big component of guilt and shame, right? Because on some level, after the fact, it's something that we did to ourselves. But the reality is, it may have stemmed from other things that maybe you didn't quite have as much control over. And so the fact is, when the skin is picked, now we have that to deal with and we can fix that. And there's things we can do to help the skin. I think it's not as helpful when doctors say, avoid picking your skin. Well, we know that. We all know that we shouldn't pick our skin, but we do it anyway. And so it's not helpful to just say, stop doing it. It encourages the guilt and shame. I think in today's world, people are more understanding that, okay, it happened for whatever reasons. And now let's work on trying to minimize any of the effects of it and find ways to prevent it from happening again. Move forward in a positive way.
I love that. And what kind of general skin tips do you give for those who have just had a skin picking session, whether they're trying to heal some broken skin, as you say, or even the long-term effects like the hyperpigmentation marks or what have you? What kind of tips or advice would you give?
Absolutely good question. So I have a whole little spiel on this because I tell this to my patients all the time. So first of all, once the skin is picked and maybe a little bit traumatized, I actually, especially for somebody who's acne prone, I usually recommend using an antibacterial lotion. Even if the skin is a little bit broken. So something like clindamycin, which is a prescription in the United States, but even over-the-counter antibiotic or antiseptic solutions like Hibiclens or chlorhexidine, even an alcohol swab can help. And the reason is because most of us pick our skin with our nails. Our nails have, one of the highest concentrations of bacteria living underneath them. And so when we pick our skin, we are breaking the skin and then depositing a whole bunch of bacteria there. And that is what allows acne to grow and to get inflamed and then to subsequently leave hyperpigmentation and scar. So first step is decrease the bacteria. So with some of these antiseptic solutions that I mentioned, maybe even decrease the inflammation with something like an ice cube, because inflammation sitting in the skin can trigger scarring and hyperpigmentation. And then my favorite intervention after that is done is a hydrocolloid dressing. So hydrocolloid dressings are a type of bandage that can be purchased pretty affordably at pretty much any drugstore. You don't need any fancy brands. You can order them on Amazon or at a local drugstore. They're usually about a 4-inch by 4-inch square dressing with a sticky side. And cutting just a small piece of that, whatever shape or size you need to fit the area of skin picking, is one of my favorite recommendations, because it not only helps to quickly heal the skin, it also serves as a physical barrier. Because the next time, because it's really common, right? Once you've picked your skin, you realize, oh, now there's something there even more. And so you go back and pick it more. Yeah. And that's just going to further the problem. And so putting that hydrocolloid bandage there helps serve as a reminder and as a barrier that every time you go to touch it again, there's something there and you can't quite get to your skin. And so this is actually a method that I use for myself. Whenever I pick my own skin, I do these steps and then I put the hydrocolloid dressing on whatever the spots are. And that way it prevents me from touching those areas further. Another thing that I recommend for patients who have a tendency to pick at their skin, because obviously, as I mentioned, it's very easy to say, don't pick at your skin, but it's actually hard to implement. And so I find, just having some personal experience with this, that having something else to use as a nervous habit with your fingers is helpful. So when I was growing up in school, I used to have an eraser that I used to kind of just toy with when I was studying. And I recommend keeping an object like that nearby when people are experiencing anxiety or having to focus. 10 times out of 10, when I ask my patients, do you tend to pick your skin more when you're feeling nervous or anxious, or if they're a student when they're studying, they always say yes, because it tends to surface when you're, feeling that nervous energy. And so I recommend keeping, stress relief balls or something to just serve as the thing to do with keep your hand occupied instead of letting your skin be the receiving end of it.
Cool. Yeah, I know there's quite a lot of people within this community who have a lot of like fidget toys or like fidget jewelry, things that they can kind of keep at their desk or on their person, just for when they feel like their hands need to move, it, you need to kind of self-soothe in a different habitual way. One thing that I know from my own experience and from others that I've spoken to over time with the kind of fidget toys and whatnot is that there isn't as much satisfaction from that. And so when there are big, say in this example, like anxious episodes, and they have an opportunity where you're all alone and you've got, a brightly lit space with a mirror and whatnot, it's very easy to just choose that one, understanding, the repercussions, but still wanting to go for it for that high satisfaction in that moment. Would you say, I don't know, do you speak to your clients about these particular moments, if there's anything that they can do to help them in that moment, or would it just be a case of if it's going to happen, then you implement these steps to kind of help your skin as best as possible?
Absolutely. I think it's a little bit of both. So definitely these steps, that the reason I like that hydrocolloid dressing tip is because that is a dressing that helps to heal even the deepest of wounds. So originally in medicine, those dressings were used for large ulcers on the legs in diabetic patients and this and that. And so it's powerful to help with the wound healing. So I think falling back on that as an always option, no matter how severe a picking episode may be, is not a bad idea. But also see a dermatologist. We are medical professionals or physicians. We understand that there may be a mental health component in this, and there's no shame or guilt or blame coming from the doctor's side. I would look at a patient's skin and say, okay, it's time to figure out how to heal it. And the reason I suggest seeing a dermatologist, especially after a particularly severe episode, is because of potential issues like infection, making sure that there's nothing else like that going on, and also coming up with ways to reduce the scarring. Because in the moment, obviously we know intellectually that it may lead to scarring, but the high satisfaction that you mentioned makes us still do it anyway. However, as a dermatologist, when I would help a patient, I would want to help them try to achieve their skin goals even in the long term. And so I would be thinking of ways that they could help their skin heal fastest and in a way that, would allow them to have optimal skin health later.
That's great. And also other areas that that those within the community have got in touch with, because different things will trigger people to skin pick. Obviously, some people may search for what others will perceive to be nothing there, and they'll kind of focus their attention on that. But there may also be other things on the skin that may be causing them to try and perfect their skin and kind of take control of that appearance. So whether it's kind of ingrown hairs or scabs or acne, it would be really good to kind of understand what we can do to help these kind of physical problems, you could say. Some would say that they are problems on the skin, to kind of help reduce the need to perfect and pick at those areas. So the first question on the list would be kind of what would be the best way to kind of clear breakouts, not just on the face, but also kind of on the body, oilier areas like the back, the chest, the butt, things like that.
Such a great question. And this is such a common issue because a lot of people talk about acne on the face, but there are other things that come up on other parts of the body, especially easily reachable parts of the body, like the back and the chest. And so body acne is one thing. And sometimes using standard acne treatments that one would use on the face, on the body, actually helps. And that's sometimes what I prescribe in the office. But another component is folliculitis. So folliculitis is inflammation around the hair follicles. The two most common causes are bacteria and yeast. And these are bacteria and yeast that are normal to human skin. So they're not an infection per se. It's just that sometimes those bacteria or yeast cause a bit of inflammation around the hair follicle. And that can look very much like acne. It can look like little red bumps. It can look like little white pustules, or what we call them, or kind of inflamed clogged pores almost. And they're very tempting to pick. They tend to happen a little bit more when a person runs warm, because bacteria and yeast like warm, moist environments. Tends to be common in people who work out a lot or sweat a lot, or, for example, will work out and remain in their sweaty clothes for an hour or two. It tends to be pretty common. So getting rid of that body folliculitis is actually relatively easy. One name for it in the media these days is fungal acne. There isn't really such a thing as fungal acne. It's just referring to folliculitis related to a yeast. And so, believe it or not, using anti-dandruff shampoos as a body wash can help greatly reduce those breakouts. You can use it for the butt. You can use it for the back, the chest, the abdomen, the groin area. And it really significantly can help reduce the folliculitis. In fact, one of the common medications I prescribe in the office for folliculitis is a prescription strength anti-dandruff medication.
That is so, can I just say that is so like insane that you've said that, because my normal shampoo has run out and I've been using my other halves, and he loves a particular anti-dandruff brand. So I was like, right, I'll just use that. And I didn't know, but from hearing your explanation, I definitely think that's something that I struggle with, is for whatever reason, especially on my arms and shoulders. And because they're so close to my eyes, it's very easy for me to pick those areas. But I have found that since using this shampoo, that these bumps have kind of been less as noticeable. And I just did not, it could be that, it may not be, but that's so surreal, like that you've said that. I'm like, wow, okay, it could.
That's so funny. And I bet there's a component of that, because most people have a little, I mean, it's normal to human skin, so most people have a little bit of this. I would actually go so far as to say everybody should use a little bit of anti-dandruff shampoo as a body wash once in a while, because we're all prone to it. I actually do that myself in the shower. Wow,
okay, that's great. He's not getting that back. He can buy some more. It's mine now.
One other tip on that, now we cover the yeast aspect, but the bacteria aspect. So benzoyl peroxide body washes, or acne washes that people generally use for the face, can also use that for the body, and that can help clear some of this up as well. I find that to be particularly useful for breakouts on the butt. And, butt breakouts are actually it's a common source of frustration, because I think more so than face, they tend to leave these hyperpigmentation marks. And so benzoyl peroxide is a great, easy, over-the-counter, affordable option that you can just use in the shower to wash and really decrease the breakouts.
That's a really good one to use, because you don't hear a lot. I mean, maybe you do, because obviously with you being a board certified dermatologist, but for me, it's not really something that I come across online, but I do suffer from it. And because I think because there's a lot of shame in that, not a lot of people like to admit, because that's kind of an area that you want to feel good about yourself. You want to feel, and Botany really kind of puts a pin in that balloon. So so I think that's something that will help. Well, myself, I'm definitely going to try that. I don't know whether there are any things that any myths online or things that you've read over in the past that people are saying, these are really good, but actually they're not, so that maybe you can kind of stay clear from them if you would, suggest to avoid certain ingredients or products.
That's a great question. This is an interesting topic because I think there's a vast discrepancy between what is available in the beauty world and what dermatologists talk about, because there are so many products patients bring in. Literally, have patients bring in their bag of all the products they've used and spent hundreds of dollars on and say none of these worked. And I take a look at them and I'm like, yeah, I could have told you that before you bought them. And I wish I had a way to have told you that. So some of the acne ingredients or products that I don't really think do a whole lot are salicylic acid containing products. So a lot of acne washes contain salicylic acid. Yes, it is technically by the book helpful for acne. However, we have so many more ingredients that are more efficacious, excuse me, for acne rather than salicylic acid. And the issue is salicylic acid tends to dry the skin out. Similarly, even benzoyl peroxide, which I did mention as a great option for helping with folliculitis, and it is a great acne wash, but on its own, it doesn't do a whole lot, especially for facial acne or more inflamed acne. And so I actually think that even with the earliest signs of any of these things, body breakouts, butt breakouts, face breakouts, it's worth seeing a dermatologist. You don't have to wait until your skin is really inflamed or really bad to say, now it's time to see a dermatologist. I think a lot of people think, oh, it's not that bad. I can probably just get some drugstore stuff. And then if it gets really bad, I'll go see the doctor. But I actually think seeing the doctor, even with the tiniest little bit of anything on your skin, is not a bad idea, because we can help formulate a plan, whether prescription or not, that would be most suitable for your skin type and help come up with a way to treat all the various things. I think the other issue is it's hard for a person to know if what they have is acne or folliculitis, like we were just discussing, and I think a doctor can help with that. So I actually think that many of the things available over the counter may be mildly helpful, but we have so many options that are far more helpful with fewer side effects. So might as well go see a doctor about it.
Yeah, absolutely. And I, from my own personal experience, I made that decision a couple of years ago when I thought going to the doctor and only getting to a certain point, I just thought it's worth it. It's worth the time, the effort, the money to speak to a professional who can really assess my skin, not just the face.
Sure.
Because obviously, if you're going to a I know, just a pharmacy or what have you, and they can only really see your face, but to be able to speak to a skin specialist who, you're in a safe environment that you can show areas of the body and for them to see your skin and to kind of understand very quickly what they can do to help. And as you say, there's more stronger things available. So I definitely would agree. It's helped me in my experience. So, if people are able to speak to a professional in that sense, then I think it would be very useful. But obviously if it's dermatillomania, obviously, I do think, and from my own experience in the past as well, focusing entirely on the appearance only and just wanting to get, in quote, perfect skin, which I don't really think exists.
Nobody has it.
I think, taking it with a pinch of salt, of that, if it is mentally related, then the mental side does have to be addressed at some point too. And it's not all about buying fancy lotions, creams, and just because I presume you've probably met a lot of people who find it very difficult to kind of face that part of it. And it's very easy, especially when you see some immediate results physically, to kind of want to stay on that bandwagon and just keep putting your attention all in the appearance, and obviously that can then open some other doors, like body dysmorphic disorder and other disorders and stuff.
And I think in dermatology, we see this interface between skin and psychiatric things very commonly, because there is exactly this gray area where, you know, things on our skin or our hair are easily controllable, whereas we sometimes don't want to admit to ourselves that we're experiencing anxiety or depression or whatever other psychiatric feeling. Because of this interface, there actually are some people who are double board certified in psychiatry and dermatology to be able to help patients with things that interface on both, right? So we're talking about ways to heal the skin, but how do we address the, you know, severe anxiety that may be underlying it? And I think a big part of this is having conversations like this. You know, in the past, it was so stigmatized, mental health, but in today's world, I think things are getting better and better. You know, we recognize mental health as such an integral aspect of overall human health. And why would one ignore it? You know, it's like if you have a pain in your leg or you have a headache, we don't just walk around pretending that it doesn't exist, right? We want to find a way to get better, and the health professionals are there to also help you get it better. So I think that addressing that underlying aspect can only be beneficial. I'm hopeful that as our world gets more and more, you know, educated, and we're able to understand these and accept these things more, we'll realize that many people struggle with mental health issues, and it can manifest in many different ways, and there's no reason for any stigma or shame around it.
Absolutely. And that's really great to hear that. in you know, this day and age, we're having professionals who are double certified in both the physical elements but also the mental elements, so that people can get a full 360 approach. And that thinking back maybe a couple decades ago, or have you, like that, just I can't imagine that was a thing.
Exactly.
So it just shows that having conversations like these, raising the awareness, talking to loved ones, doing the research, and maybe even conducting and like studies, being part of studies or anything. It's spreading the awareness and ultimately spreading the resources. The resources are growing, the research is growing, and that's so amazing. So another question that someone has asked is about how do you get rid of hyperpigmentation marks?
That is a big topic and a tough one, but such an important one. I think anybody is able to get hyperpigmentation, but it's far more common in people who tend to tan easily, because the same thing in your skin that makes you tan in response to sun exposure makes you hyperpigment in response to trauma or inflammation. So that tends to be people with more olive skin or any skin darker than that. So I have a lot of patients who come in with acne, but really it's not so much active acne that's bothering them, it's the brown spots that were left. And that can happen after skin picking as well. So hyperpigmentation, the reason it happens is because deposition of pigment is triggered by whatever the trigger was. So whether it was picking, so trauma to the skin, or inflammation from acne, or a little bit of both, there's a deposition of pigment in the skin. So now removing that pigment is actually rather difficult, but there are a lot of things that can help. First and foremost actually is sun protection. Because sun exposure to any inflamed areas or even hyperpigmented areas causes that pigmentation to last longer. And so sun protection is absolutely vital. It's the number one recommendation. Then allowing the skin some time. So usually hyperpigmentation, the official term is post-inflammatory hyperpigmentation, or dark spots that happen after inflammation or picking. It is temporary. It can last, 6 months, a year, and picking at it even further can worsen it. And so using something like the hydrocolloid dressing is not a bad idea, even if there's no broken skin, because it will help prevent you from further picking. Now, there are some medications actually that can help reduce the hyperpigmentation as well. So some ingredients that I like are hydroquinone. Hydroquinone is a controversial ingredient. There are some potential side effects, that some of which are true, some of which have never been proven, but hydroquinone is effective when used as a spot treatment regularly to help decrease that pigmentation. It's a little tricky to use because it has to be applied only to the brown spots, because it's on some level actually a bleaching cream, and it will lighten normal skin too. And so I actually don't recommend hydroquinone that frequently unless somebody is highly motivated to apply it specifically to those dark spots using something like a cotton swab. More exciting than hydroquinone to me is tranexamic acid, which is a relatively newer ingredient. It's made by brands like the Inkey List. You can get it over the counter. Skin Medica makes a product called Lightera 2.0. SkinCeuticals makes discoloration defense, and all of these employ tranexamic acid, which can help make the hyperpigmentation go away a little faster. And you don't have to apply it only to the brown spots. You can apply it all over. There are many, many other ingredients that can help: arbutin, vitamin C, kojic acid, retinoids. So one can come up with a very long skincare regimen to combat the brown spots, depending on how much time you want to invest into this. But the main things that I would say are just sun protection and time, especially if you have skin prone to that.
Right. Okay. Because like what you're saying, especially when you've got clients coming in and they're literally unloading their bag full of products, and especially with the skincare culture now, where there seems to be a product for literally every little thing, and the marketing out there is like, you need this as part of your 20-step routine. And I've definitely hold my hands up and say I've been guilty with that. So yeah, it sounds like by speaking to a professional such as yourself, it's quality over quantity. You don't need to waste time or money on so many different marketing gimmicks that you can get online and everywhere else.
Absolutely. Couldn't agree more.
Okay, that's really interesting to know. Another question that we've been asked is about stubborn blocked pores. Is there anything, I don't know, like one ingredient or one specific product or what have you that someone who is struggling with really stubborn blocked pores can actually benefit by adding to their routine?
Great question. And again, a big topic and one that's a little bit difficult to answer. So the mainstay of therapy for blocked pores, which are actually a type of acne, by the way. So whiteheads and blackheads are the start of acne. And the mainstay of therapy for that are topical retinoids. So anything from retinol over the counter to prescription strength retinoids to even oral retinoids, which are things like Accutane or Roaccutane. All of those are actually the mainstay of therapy for getting rid of blocked pores. But for some people, despite using that, they still have some clogged pores. And that, I think, is actually quite difficult to combat. I do sometimes recommend in-office extractions because that can be done in a sterile environment in a way that doesn't traumatize the skin as much as us at home using our nails would traumatize the skin. That can further help a little bit. There are procedures such as hydrofacial where you can get even more powerful extractions done. There are laser procedures that can be done that actually shrink your pore size, and that will make it more difficult for your skin to have clogged pores. And then using over-the-counter ingredients such as AHAs or BHAs can also be helpful. I say that with the caveat that I like to optimize skin for tolerating the strongest retinoid that the skin can handle because it has a multitude of other benefits like combating hyperpigmentation, like helping with acne scars, like decreasing pore size. And so the retinoids are really just the most multifunctional ingredient. So I like to optimize for that. And if that means decreasing AHAs because retinoids dry the skin out and so do acids, then I'd rather have somebody focus on the retinoids. But if the skin is able to tolerate it, using a once weekly glycolic acid peel, for example, Skin Better's Alpha Ret peel pads can be very helpful in decreasing blocked pores.
Okay, so there's a number of ways that people can help combat their blocked pores from over-the-counter creams, retinoids, or even the pads that you've just mentioned, or even the treatments that you can get scheduled in. Okay, that's really interesting. Also, I've got a question for treatment advice for cystic acne. Now, I'm guessing for something like that, it really would depend on like getting the person in and kind of monitoring that. And I know things like Roaccutane, with myself included, my own experience, that's something that I went to my dermatologist for, and that helped bring down more cystic acne. Would that be something that that you would kind of suggest first, or would it be something that you would maybe not suggest, or maybe suggest later on after trying other things?
That is a great question. I think with cystic acne, my main message I would give across is earlier evaluation is better. It's never too early. And the reason I suggest that is because I have a lot of patients who come in who tell me they've had cystic acne for years. And I know that because I can look at their skin and see their scars. And it is so much harder to go back in time and figure that aspect out, because first we have to treat all the active acne. Then once the active acne is gone, then we do these expensive laser procedures and microneedling and this and that to help reverse the scars. And it is very possible, even with the worst scarring, to get the skin back to normal. So that's possible, but it's a lot harder than if we were to have just prevented it from getting that bad in the first place. And so I think early evaluation at even the slightest hint of cystic acne, especially cystic acne, because that's what leads to scarring and hyperpigmentation, is essential. But I think a lot of people are scared to go to the dermatologist because they think, oh, they're going to try to give me antibiotics or Roaccutane or something really scary sounding. But the reality is, what I usually do is sit down and talk to my patients through what all of their options are that would help to address their skin, from the most, the easiest, smallest skincare routine and sticking only to topicals, to something more intense like oral medications. And I talk through all the side effects of all that and let patients make their own decisions, because some people feel more comfortable just sticking with topicals. And if that's the case, then we come up with the best, appropriate topical option for them. And some people want faster clearance and are open to doing stronger medications like pills, like spironolactone or Accutane, and then we can talk about that. So I think that there is a option for everybody, and even just talking about it ahead of time can help inform a patient, even if it just means they want to go home and think a little bit more, because the internet is a scary place when it comes to acne and cystic acne treatments. It's very hard for a person on their own at home to figure out exactly what kind of acne they have. Is it hormonal? Is it not? What's triggering this? Is this bacteria? Is it diet related? There's so many questions that people have, and seeing the dermatologist earlier than later in my books can only help.
Okay, that's amazing advice. And I think that'll help a lot of people. And then lastly, I just wanted to ask if you had a personal quote or a mantra that you stick to. I think it's a lovely way to kind of get to know yourself, and something that we can kind of ponder on as we draw this conversation to a close.
That's actually a really interesting way to end things. And I think the quote that I actually tell myself a lot, or the saying, excuse me, I was actually told by the person who taught me meditation. So meditation is a big part of my life, and it's something that I've tried to implement on a day-to-day basis. And one of the things that I was told regarding that was, the way things are right now is the only way that they can be. And it's something that I remind myself all the time. The way things are right now is the only way that it can be, because I think we all experience guilt a lot for a lot of different things in life. And I think it's particularly fitting considering we're talking about skin picking and some of its effects. But I have to remind myself a lot that the things, the way things are now, that's the only way they can be. That means I can't change anything that happened in the past. And so it's easier for me to just let that go and focus on, what can I do to change the future? And that really helps guide me in my interactions with patients and in my personal life.
Oh, that's so wonderful. Yeah, thank you. Thank you so much for sharing that. I'm definitely going to remember that. And to be honest, meditation is definitely something that I really want to get more on.
Yeah.
It's one of those things like that is just so life-changing, but
absolutely,
you have to practice it often.
You
have to put
the
time in. But thank you.
Do.
Thank you so much, Dr. Karhade. It's been an absolute pleasure. I've learned so much from this conversation, and I'm sure I won't be the only one that has. So thank you so much for taking this time. And yeah.
Absolutely. And the pleasure is all mine. It was an honor to be here chatting with you. And please feel free to share my information. I'm happy to follow the conversation up with any of your listeners.
Absolutely. And lastly, if anybody wanted to get in contact with you on Instagram, what would be the handle to find you?
Great. My Instagram handle is at Dr_Kavi, KAVI_derm. Feel free to DM me and or click on a link to book a virtual appointment.
Amazing. Thank you so much.
You're welcome.